The Joint Commission has identified safe patient transfer and handoff as a national patient safety goal. Good and quality communication prevents clinical errors and increases patient satisfaction with healthcare. Here at PIH Health, our standard for report is at the patient's bedside and including the patient when possible. In order to prepare for a smooth report time, it's suggested that the off-going nurse prepare both the patient and the patient's environment roughly 1 hour prior to giving report. This will assist in decreasing interruptions. This should include explaining what bedside report will consist of, offering to answer any questions the patient may have, ensuring that IV fluids are replaced or that piggybacks are flushed, offering repositioning or toileting, assessing and intervening for pain if appropriate.
Good morning, Mrs. Smith.
Good morning.
How did you sleep?
Good.
Good. Are you having any pain right now?
No.
Okay. We're just going to be doing change of shift at 7 o'clock, so I just wanted to come and check on you. I see your IV is full, so we don't have to worry about that. You're not having any pain with your IV?
No.
Okay. Can I help you up to the bathroom right now? Let's get up and go to the restroom.
No, thank you.
Okay. You have your call light and you have your phone and you're comfortable and no pain, so
Yes.
I'll be back in a little bit with Cheryl.
Okay.
Remember, quality communication requires both a good listener and a good speaker. Regardless of the content that is shared, if it is stated in a scattered manner or the receiver is not listening carefully, the information can be corrupted or lost. Let's watch an example of report in which the information is not streamlined or organized.
Hey, Miss Smith. So this is Cheryl. She's going to be your nurse today, okay? So
Okay.
this is Miss Smith. She's a 42-year-old female. She's MPO. She came in for, she was just like feeling nauseous, her stomach hurt, and so we came in and we found her, she like had a GI bleed, and so Dr. Johnson, he did an EGD and he clipped it, and she's a full code. We're giving her protonics, and she has the ALFs on. She walked with the gait belt. You don't need her history, right? You know her. So
I can look it up.
oh, okay. So good. Sorry, I just so she has her abdomen's distended. It's soft. She pooped this morning. Oh, her urine. She has a UA, so she's on row 7. Do you have any questions?
Are we doing any labs or?
Oh, yeah. I think we're checking CBCs.
Do you know what it was the last one?
They didn't tell me. I don't know.
What were your thoughts as you listened to this report? Now let's watch an example where poor listening skills affected quality handoff report.
Morning, Cheryl.
Hey.
Do you have our lady, Mrs. Smith?
Yeah. Okay. I'm ready for report. Yeah. You want to just do it here?
Well, I had already told Mrs. Smith that we were going to do it at the bedside. So,
Okay. Hold on. Let me just write down my last couple meds.
Teamwork and report is affected by poor listening skills and other nonverbal communication.
okay. So this is Mrs. Smith. She's a 42-year-old female. She's a patient of the hospitalist and Dr. Johnson for GI. She was originally diagnosed with a GI bleed. She presented with complaints of having black stools for about 2 days.
Did she have an EGD already or anything? Like, what did they do?
Yeah, so the EGD was yesterday, and they clipped some, her esophageal varices.
Okay. And she's eating now, or is she?
No, she's NPO. So since she was admitted, her vital signs were stable. She's
You have a flush here that you didn't sign off from 6 a.m. Just make sure you do that.
Okay, I'll make that when I get out of the house. She actually has IV fluids going, so I didn't flush her. She just has a little one. So she's been afebrile. She's a moderate fall risk because of her lines, and we're giving her the ALPS. And
Are you back tonight, by the way?
No, sorry. I'm off for a while. So for the GI bleed, she's in PO, like I said, she's on the Protonics every 24 hours, and just the IV fluids. Dr. Johnson's going to be in today. No signs of bleeding.
Who's the GI doctor?
It was Dr. Johnson. He was the one who did the EGD, and everything is here in PO. Do you want to add anything? Did I miss something?
No, it's alright.
Alright.
No.
All right.
Oh,
Thank you.
she has a positive weight. So sorry, she has a PTI.
Okay.
So she is on the second.
Okay.
Do you have any questions?
No, I'm good. Thanks.
Okay.
Now let's watch an example of a streamlined, consistent, and considerate report between two clinicians. The evidence-based communication tool, known by the acronym I Pass the Baton, was developed specifically to assist in giving quality handoff report. This creates a steady and appropriate flow of information. Follow along and see how the nurses did.
Hey, good morning, Gerald.
Hi.
Do you have our lady, Mrs. Smith?
I do.
Okay,
Yes.
are you ready for a report?
Yes. Let's go.
Good morning, Mrs. Smith.
Good morning.
This is Cheryl. She's going to be your nurse for the day.
Nice to meet you, Mrs. Smith. I'm just going to put my name up on the board.
Okay. We're going to do the bedside shift report that we talked about earlier, okay? Feel free to ask any questions or give us any input as you feel necessary. Okay, so this is Mrs. Smith. She is a 42-year-old female. She is a patient of the hospice. Today is Dr. Raja and Dr. Johnson for GI. She was admitted with a diagnosis of GI bleed. She was presented with black stools for 2 days. Since being admitted, vital signs have been stable. Her blood pressures have been ranging systolically around 110, and she's been sinus rhythm on the monitor. The last 12 hours, she has been afebrile, and she hasn't had any signs of bleeding since she was admitted. She's on room air. Her lung sounds are clear. Her skin is intact, other than the jaundice in her sclera. Her abdomen is distended, but it is soft, and her last bowel movement was this morning, and there was no signs of bleeding with that one. We also found her to have a positive UA, and it was the culture grew out E. coli. She's on rocephin through 24 hours. She is a full code, no allergies. She's awake, alert, and oriented. For her GI bleed, her order is NPO, and we're just doing Protonics IV Q24 hours. She's a moderate fall risk, and because of her IV lines and her PRN pain medication. She is a BMAT level 4. She's able to ambulate with minimal assistance with the gait belt. She's usually independent at home and lives with her daughter. For her VTE, we're using the ALPS, and because the heparin is contraindicated because of the GI bleed. Her history includes Hep C cirrhosis, recurrent ascites, and she has to receive paracentesis about 5 to 6 liters every 2 weeks. Her last paracentesis was 5 days ago, where they took 10 liters out. Her home meds have been reconciled, and it included her Lasix and her Soma for her back pain. While admitted, she had an EGD, which was performed yesterday, where they found some esophageal varices, which Dr. Johnson had clipped them. Per Dr. Johnson, she will remain NPO until tomorrow. We're just going to continue the PPI and the IV hydration. She's receiving D5 half NS at 100 mLs an hour, and we're checking CBCs daily. The doctor wants us to call for any signs of bleeding. We're checking her vital signs Q4, and we just notified the CNAs to notify if her blood pressure is less than 110 systolic.
plan today is that Dr. Johnson is going to be in to see her, and our goal is to get up and walk in the hallway at least 3 times today, and then when she's able to eat, she should be up in the meal or in the chair for meals. Do you have any questions?
Well, you said we were doing serial CBCs. Has her hemoglobin been stable?
It has been stable. Her most recent one was 10.1.
And anything specific in the plan of care for this patient?
Oh, I did. I forgot. She is a Jehovah's Witness, so since the GI bleed, she did not receive any PRBCs per her wishes and her religious preference.
Do you have any questions?
No. Okay.
All right.
Thank
Here's
you.
your call line if you need anything, and I'll be back to see you soon. Okay?
Okay, thank you.
Do you have any more questions?
No. Any other sensitive information for this
Yes.
patient?
Last night, Mrs. Smith and I were talking, and she did say she really had a problem with alcohol in the past, and she's been under a lot of stress lately. So I just ordered a social work consult just to make sure that she's able to cope with that a little better instead of going back to the drinking.
Great. Thank you. Have a good day.
You too.
As a team, we can ensure that handoff report is streamlined, consistent, and considerate, keeping our patients safe.